Hello everyone, I am Catherine D. Ramos and this is Group 5 video presentation for General Biology 2. This discussion contains the definition, the types, the people that are affected, the symptoms, the history, tips on how to prevent warts, how the disease affects our body, and especially how to treat the disease. So without further ado, let's start the presentation. So, what are warts? Warts are flesh-colored raised areas that is caused by a viral infection called the human papillomavirus or HPV. Warts are non-cancerous skin growth that can develop to your skin and in your mucosa or the inside of your mouth. Warts are very contagious and very common, especially for children.
Good day everyone, I'm Micaela Villanueva, Assistant Leader from Group 5, and I'm here to discuss what causes warts. First thing first, warts is caused by human papillomavirus or HPV. There are more than 100 types of HPV. This can enter the skin through small cuts and cause extra cell growth. Some types of HPV infection is cause of warts, and some can cause different types of cancer. Warts viruses are mainly spread by direct skin contact, but they may also be spread by touching objects. HPV is classified into low risk and high risk. Now, let's proceed to the low risk HPV. These types are usually cause of non-cancerous conditions such as warts on the skin, genitals, mouth, or throat. Also, the high-risk HPV. These types can cause cell changes that may lead to cancer over time. In some cases, immune system clears the infection, but if warts persist, it can cause abnormal cell growth that may turn into cancer. Additional information, warts can appear on different parts of the body, depending on the type of HPV. First is hands and fingers. Common warts are often developed on the hands, fingers, or around the nails. The second is feet. It appears on the soles of the feet, often causing pain when walking. The third is genital area. It appears the penis, vulva, anus, or around the genital region. These are typically caused by certain strains of HPV. The fourth is face and neck. Warts can develop on the face or neck, especially in the children. The fifth is knees and elbows. It appears on the knees, elbows, or other parts of the body. And the last is mouth and throat. Warts can occur inside the mouth, on the lips, or on the throat. And that's all for my discussion. I hope you learned something on it.
What is genital warts? Genital warts are sexually transmitted infections caused by a certain types of human papillomavirus. They may be flat or project out from the surface of the skin, and their color may vary brownish, white, pale yellow, pinkish red, or gray. Mosaic warts. Mosaic warts are a type of plantar warts that grows in clusters on the bottom of your feet. While some mosaic warts go away in their own, others are harder to treat and may require a doctor's interventions. Plain warts. Plain warts, also known as verruca plana, are type of skin warts caused by the human papillomavirus, characterized by small, flat, smooth, skin-colored bumps that usually appear on the face, hand. They are typically multifold and can spread through shaving or scratching in affected areas like the third or leg. Mucosal papillomas. A mucosal papilloma is a wart-like growth that occurs in the moist mucous membrane of the body, typically caused by the human papillomavirus, and can appear on areas like the genitals, anus, mouth, throat, or cervix. Most mucosal papilloma are considered low risk, rarely develop into cancer, especially when caused by low risk HBV strains. And lastly, cancerous warts. Cancerous warts can refer to varicose carcinoma or squamous cell carcinoma, which are skin cancer that can look like warts.
Common warts. Common warts are also known as verruca vulgaris, are one of the most common types of warts. Plantar warts are a common wart that develop on the soles of the feet. Flat warts. Flat warts, also known as verruca plana, are a common types of warts caused by a human papillomavirus. Filiform warts are a type of warts caused by the human papillomavirus. Unlike other warts, they are characterized by long, thin, thread-like projection that extends from the skin surface. Periungual warts. Periungual warts are warts that grow around the fingernails or toenails.
Warts-related and self-reported human papillomavirus-related psychosocial impact among male and female patients aged 18 to 6 years old in the Philippines. Overall, genital warts prevalence was estimated at 4.78% for men and women aged 18 to 60 years old. Genital warts prevalence was 3.39 and 8% among women and men, respectively. Prevalence estimates were highest in infectious disease specialist practices 18.67%. Two-thirds of 233 male and 166 female patients were newly diagnosed genital warts cases.
Hello everyone, I'm Prince Sherby Bayani from STEM 11-2 St. Louis, and this is my video presentation about the history of warts. In 19th century, dermatologists began using electrocautery and acids like salicylic acids for warts removal. Scientists also started suspecting an infectious cause, but the true breakthrough came in 1907, when Italian scientists demonstrated that warts could be transmitted by an infectious agent. In 1935, American virologist Richard Schompe discovered that a virus caused warts in rabbits, leading to further studies on HPV in humans. In the 20th century, confirmed that the viral nature of warts. This discovery paved the way for modern treatments, including site therapy or the freezing warts with liquid nitrogen, laser treatments, and topical medication like Imokid and salicylic acid. Today, warts are treated using a variety of methods including over-the-counter remedies, professional dermatological procedures, and immune-boosting treatments. Despite centuries of medical progress, warts continue to be subject of both scientific study and cultural superstition around the world. Thank you.
I'm Mariel DC Asis, and I will tackle to you what are the symptoms of warts. Warts are very common skin disease. It can be easily to identify because it's only on our skin. It can be seen on our face, neck, body, especially on our hands and foot. Warts can be distinguished as small raised bumps. It can be smooth or rough, and they are flesh-colored gray or brown, and in some rare cases it can be black. And in some point, warts can be itchy and painful, and sometimes it can be bleeding. That is all the common symptoms that we can be distinguished warts in our skin. Thank you for watching.
So the question is, how warts can affect a person's daily life? Well, warts can significantly affect person's daily life in various ways. For example, when warts appear on your fingers and hand, they can make things like writing, cooking, and typing uncomfortable. And when warts appear on the soles of your feet, they can make things like running, walking, and standing for too long painful. While warts on visible areas like face, neck, and arm can lead to self-consciousness and embarrassment in social situations. Some may feel reluctant to shake hands due to fear of spreading the virus. Additionally, warts can be itchy, irritating, or even painful, especially when they are in areas prone to friction and pressure. Beyond physical discomfort, warts can also impact emotional health. Some may experience bullying and teasing due to noticeable warts on their skin. While warts are generally harmless, they can disrupt person's daily life, making things challenging. Managing warts often requires patience and consistent treatment in order for it to stop spreading and worsening. In this clip, I am going to talk about the effects of warts in our body and what body system is affected by warts. So firstly, warts can affect our body in different ways. One of this is skin growth. Warts appear as rough, hard bumps that is usually found on feet, faces, hands, or genital area. Next one is the pain and discomfort. Some warts, like plantar warts, like I've said earlier, it can cause pain while walking, running, and standing for too long. Next one is the weakened immune response. When people have weak immune system, warts can potentially grow more and take longer to heal. Next one is spreading. Warts can spread in different parts of our body and can spread to other people by direct skin contact. Next is what body system is affected by warts. The answer for this question is the integumentary system. The integumentary system consists the skin, the hair, and the nails. So how this disease affect the system? Well, the virus can cause rapid skin cells to grow, leading to formation of warts. And this affected skin area may become bumpy, raised, rough and thickened that can cause pain and discomfort.
Good day everyone! How to treatment warts? Salicylic acid, this is a common treatment found in gels, liquids, and patches. Salicylic acid works by peeling away the warts. It softens skin layers of the wart and helps the body immune system fight the virus. Apply it regularly, often daily, to the wart, and it will gradually shrink and disappear over several weeks. Second, laser surgery. A pulse dye laser heat ups the blood in the wart, destroying the vessel and causing the wart to fall off. The laser may also attack the virus that causes the wart. Third, cryotherapy. More effective than home freezing, this involves applying liquid nitrogen to destroy the wart. Thank you.
Good day, I'm Stephen Horde Bernardo, and today I will discuss the essential measures to prevent the spread of warts, which are skin growths caused by the human papillomavirus, or HPV. Warts are a common dermatological concern, and while generally harmless, they can be both unsightly and contagious. The following guidelines are recommended to minimize transmission and protect both oneself and others. First, strict hygiene is paramount. Regular and thorough hand washing with soap and water is an effective measure to reduce the risk of viral transmission. Individuals should ensure that their hands are clean, particularly after touching any potentially contaminated surfaces. Second, it is advisable to cover any existing warts with an appropriate bandage. This precaution minimizes direct contact with common surfaces such as towels, gym equipment, and door handles, thereby reducing the likelihood of the virus spreading to other areas of the body or to other individuals. Third, it is imperative to avoid picking, scratching, or otherwise irritating warts. Such actions can lead to further dissemination of the virus, either to adjacent skin or to other persons through inadvertent contact. In communal settings such as public showers, gyms, or swimming pools, the use of protective footwear such as flip-flops is strongly recommended. These environments often provide a warm, moist atmosphere that is ideal for viral proliferation, making preventive measures even more critical. Finally, early treatment is essential. While over-the-counter remedies are available, I encourage those affected by persistent or bothersome warts to consult a healthcare professional. Prompt and appropriate treatment can help curtail the spread of the virus and expedite recovery. In conclusion, by adhering to rigorous hygiene practices, covering affected areas, avoiding direct manipulation of warts, and seeking early treatment, we can effectively reduce the risk of wart transmission. Thank you for your attention.
For our doctor's interview, we interviewed Dr. Tara Valenzuela, a dermatologist from Primorosa Aesthetic Clinic. She stated that warts are very common and it is scientifically known as verruca vulgaris. It is skin growth, although it's not cancerous. It is very common, especially to young ages. She added that warts is very particular or very easy to identify because it'll cause skin growth. So usually we'll see it on the face, sometimes on the neck, and sometimes on the hands or on other part of the body. It's a little hard and thick. She said that warts are caused by HPV or human papilloma virus. When we talk about HPV, there are so many subtypes, so that's the main culprit. Also, it can be caused by hereditary. Based on Dr. Tara, since it is viral, so it's transmissible, so it can spread by simple beso-beso. You can have warts if you have beso-beso with someone who also have warts. Simple sharing of towels as well. In the pools, if someone is infected with it, can also transfer to you. Those who walk barefoot can also have warts. Warts can be prevented by avoiding those things that she mentioned, such as walking barefoot and having skin contact with someone that is infected.
Dr. Tara stated that the types of warts are also based on what type of HPV or human papilloma virus this disease have. Also, she declared that wart disease have different types, including filiform, genital warts, common warts, and flat warts. She added that warts is a mild disease that can disappear spontaneously, but can be a serious problem, usually complication if you have genital warts, because genital warts is active on sexual intercourse. Dr. Tara also said warts can appear in different types of our body. It would be better for some patients if they are going to professional for heavy treated to avoid spreading the disease. Last, she mentioned that we have different types of medication, treatment, laser treatment, and surgery, and all of these are effective to get rid of the disease.
She stated that warts could spontaneously resolve on their own, but the process might take several months or even years. Given this prolonged timeline, she strongly advised having them removed. Waiting for them to heal naturally carried a significant risk, as they could multiply and spread, making the condition more difficult to manage over time. She said that retinoids would not be able to resolve a wart infection, as they function more as a supplement rather than a cure. While there were other methods to remove warts, she emphasized that the ones she had mentioned were the most effective options available. She expressed that the healing time would not be the same for every procedure. In the case of cryosurgery, patients would need to wait for a certain period for the area to heal. However, with electrocautery, the recovery time was much shorter, typically just 3 to 5 days, as the wart would form a scab, dry up, and eventually fall off. So the duration of healing would depend on the specific procedure chosen. She announced that warts could resolve spontaneously, but the process could take several months or even years. She also warned that since warts are caused by a viral infection, there was always a possibility of recurrence. For instance, even after successfully removing warts, Exposure to others with the infection could lead to reinfection. Given how common the disease is, she emphasized that the importance of being cautious to prevent it from returning. She stated that warts could still recur even after being removed through a specific treatment. For this reason, she strongly advised patients to schedule a follow-up appointments, as there was a high possibility of the warts returning.